for me. So a summary of the steps really for me on this journey was about, one, identifying and stating our problem and being clear about that. Understanding the definition of what we meant by a personalised care and support plan, because that was important. Seeking support and asking for help, and then receiving that information. And then checking on the quality, did that fit the description, the information that we were getting in? And then what were our reporting issues, and then next steps following on from that. So I'm just going to sort of talk about those, if that's okay. So our problem was, I was aware that things were happening, but we just had this big gap really, and it was a big problem for us. So we didn't know where the data on personalised care and support planning was, or what the picture looked like. And so to give you some idea, I think our target was about 26,000, and we just got over about 7,000 at end of Q3. So we were way off, but Devon's massive. There's lots of work going on, so it was a bit of a sleuthy thing to try and find out. So we also had no systematic way of gathering data embedded in practice across our system. So it was all a bit scrabble, trying to get what you could, for each quarter. Changing organisations and changing roles didn't help. So we had people who once knew and then moved on into another job. And that was always a problem as well. So roles and responsibilities were unclear. And actually understanding that lack of data didn't necessarily mean it wasn't happening somewhere. It was out there somewhere, but we needed to go and get that. So you can see, it was 7571 reported at Q3, and our target was 24,600, so it was a big gap.
Sorry, that number related to precisely what?
Personalised care and support plans.
Right,
There's a number of personalised care and support plans. So I sort of hunted around really, and there isn't sort of any sort of hard definition about what a personalised care and support plan was. So I got this off the NHS website. So being clear that it was a way of capturing and recording conversations, decisions and agreed outcomes with people in a way that made sense to them. That it was proportionate. Hello. I'm sorry. No, don't worry, it's fine. Flexible and coordinated and adaptable to a person's health condition, situation and support needs. And should include a description of the person, what matters to them and the necessary elements that would make their plan achievable and effective. So basically what I did was I put this definition on an email and then made a list of all the people who might be able to help me, and explained what our dilemma was. So I really liked this quote really from Peter Drucker. He says, what gets measured gets managed as well. And it just, because after there was something about loss of an opportunity within our system about raising the profile of personalised care and support planning. So what I needed to do then was go and identify who can help, including line management support. Saying why I needed it, what would be the outcome for us as a CCG from not reporting that. Asking our commissioning leads, they were always supportive and helpful around that. Asking business intelligence, who came at trumps no end and were really helpful in the end. And actually looking in places where policy demand a personalised approach as well. So a good example that I'm familiar with is things like building the right support, which was the transforming care documentation. So although those numbers were very small, those personalised care and support plans are really important because of the complexity of need, the risk, and actually the costs as well of those packages of support. So we wanted to make sure that they were there as well. So we covered both large and small populations in our quest and our search. Okay. So the information came in, hooray! It was like, oh yes, people have responded. I did give a deadline as well, a few weeks I gave them. So I reviewed that information as it came in, and I was checking it against the guidance. And I asked where possible for copies of planning templates if possible. So I think that one with all the shapes on was something that I got from hospice care. So that was really lovely. And we've got a children's hospice as well, in Devon. And so that was helpful. And then there was also some written guidance that were coming in. So as I asked for that, I said, you've got examples of your plans, do send them in. So I gathered a few of those together. Not everybody did that. Some of them, particularly there was a QOF indicator which actually stipulated that this had to be a face-to-face discussion with the person about their plan. It had to be agreed and then documented. They got a copy and then it would count as part of the QOF. That was from the mental health ones. So I kept a running total as I went on, really, and actually I was just really appreciative, saying, oh, thank you so much, that's brilliant, and isn't this wonderful work, and just trying to share the love really around it, because actually it's great that this work's happening. And one of the things that I think about personalisation is I think people can feel quite professionally and personally affronted when we're asking them, are you working in a personalised way? Because actually I think people do feel that in their heart, if they are working in that way, they hold it very dear, and to be asked that is almost an insult if we're not careful. So this was a really nice opportunity to start to acknowledge some of the activity that was going on. So the key areas that we looked at in the end, these were the things that came out. So I got the inpatient and community-based hospice activity and end-of-life planning was really, that was the stuff that when it came through it made me cry. Yeah, because it was really, compassionate, lovely, lovely work. Obviously, we were already counting, but it's worth, not to lose it, is all of the continuing healthcare personalised planning. So we've just redrafted and redeveloped in Devon our personal care planning approach as well around CHC. So that was dementia care planning. There was a lot of activity around that. There was also the QOF mental health planning and also the care programme approach work as well. One of the things to mention about mental health that I thought we could have used but isn't collected anywhere, nobody collects it, is the wellness recovery action planning. So they're highly personalised plans where people with a long-term mental health need might have a relapse, and that plan actually identifies their personal triggers or the support that they need to be able to get back on track, and that's shared and it's personal to them. So I wonder whether there might be something we need to think about where RAP plans are actually gathered. And as wellness recovery action plan used in most areas?
Yeah, I think we call it something slightly different.
Do you? Yeah.
And we have it on our joining up our information system. And that's one of the sort of plans that is actually shared across the system now. Like that's very, very new.
Yes, yeah. I think there are some rich seeds of data that we could be mining, I think. So that's one area. We also had some really good specific projects that I wasn't even aware of. So there is a mental health joint funded enabling project with Devon County Council, and also another one on personalised care as well with DPT. So that was a really good bit of work, and Sarah Dent was really helpful in terms of getting that information to us. Transforming care, we do very intensive care planning for people with learning disabilities coming out of hospital, and also for people with complex needs in the community, and also we deliver that funding through an individual service fund as well. So that's important for us. We also had some late information that came in was work from carers about individual planning and holistic support, send educational health and care plans. There's a bit of an issue about that because I think the quality varies around that. So I didn't include that in my final data. One of the things that I've done since doing this work is I've taken up chairing the choice and control work stream for our SEND implementation plan in Devon, and we're looking at the quality around DHCPs, and then also planning with people who have cancer as well. So we didn't include maternity-related care plans, just to share with you, 12,500 babies, I believe, are born in Devon every year. And I think a lot of those mothers have very personalised birth plans. But it was the fact it wasn't a renewed or reviewed plan. That's the reason why we didn't include it. But I mean, the jury's out. You might have some other ideas.
We're part of Better Births, and I think it's a regional programme.
Yeah, that's right.
And there's a work stream on personalised care and support planning for that. So I don't see any reason that we can't count it once that gets up and they get the criteria and what it is around the personalised plans. I think we could probably count the Better Births plans, if that makes sense.
So I didn't include it for this one, but I think we needed to have some further discussion. And the other thing just to say as well is that looking forward, I think there will be a stronger requirement around looking at maternity care personal budgets as well. So I shared that with our children and maternity team. We do a special focus on that. And in order to deliver that, obviously, you need to make sure that you've got personal care and support planning. So going back to what gets measured gets managed, we might want to think a little bit about how we steer some of that activity. So they were the key areas that we looked at. You might have other ones. So the added benefits really for us were that obviously there is a more personalised career support planning than we thought, and it was nice to be able to feed that back to people, so thank you. And also it just felt like a really good opportunity to encourage support and motivate people, so that was really helpful. And of course we exceeded we had over 30,000 plans. So we had some key issues then moving forward for us then. So it's really about what next, because I was still mindful that that was like another scramble at the end of another quarter, and about embedding that. But at least now we've got the roots about where we can go and develop some more gradual and systematic reporting processes. We have a need to streamline our data gathering every quarter, like I say. And we also need to embed reporting and personalisation related data as a system-wide approach, because we're not clear at the moment what our impact is, which is why I've chosen this. This is a meteor hitting the Earth. It says probably a big impact. We don't really know. So I think that how do we know what the wider impact is? And I think that's probably what you'll be looking at, Emma, later on. But you've got to start somewhere. And so that's really my journey and the process I went through to try and do. We were going to then maybe think about spending 20 minutes to think about the areas you can concentrate on in your area. I mean, we're a bijou group today, so we might be able to do that differently. But other information sources I haven't included or thought about, or we haven't discussed yet, and what action, if any, could you take, really? Is that okay?
Mm-hmm.